Actually, the people who are growing bhang in Uganda and transport and peddling through across Kenya to come to Nairobi are actually the policemen.
To understand bhang in Kenya today, we have to look at where it all started. Cannabis isn't new to Africa. In fact, it's believed to have been introduced along Indian Ocean trade routes centuries ago. In pre-colonial times, it was used for rituals, relaxation, and even medicine. But during the British colonial era, it was criminalized, seen as a native voice that needed to be suppressed. By the 1930s, cannabis was made illegal in Kenya, along with many other colonies, under international pressure, especially from Western countries. And since then, bhang has lived a double life. Officially illegal, but unofficially very present. In Kenya, bhang is classified as a narcotic drug under the Narcotic Drug and Psychotropic Substance Control Act of the 1994. That means possession can land you up to 10 years in prison, selling or trafficking it, life imprisonment. Cultivating it, yes, growing it in your shamba is a serious crime. Despite this, bhang is everywhere. From matatus to university hostels to rural farms, it has become part of youth culture, music, and even memes. Many Kenyans argue the law is outdated, punishing users rather than understanding them. The conversation is changing. More and more people are asking if alcohol and tobacco are legal, which are arguably more harmful. Then why is cannabis still illegal? In some circles, bhang is even being reclaimed as an African herb with healing properties. Rastafarian communities, for instance, view it as a sacrament. And musicians from Gidi Gidi Maji Maji to Octopizzo have often referred it in their lyrics. Medical marijuana is gaining ground. Countries like South Africa, Zimbabwe, and even Rwanda have legalized cannabis for medical use. Could Kenya be next? Scientific studies suggest cannabis could help with chronic pain, epilepsies, anxiety, or even cancer treatment side effects. Kenyan entrepreneurs and doctors are now pushing for legalization, not just for health reasons, but also for the economy. In fact, in 2023, a Kenyan MP even introduced a cannabis control bill proposing to regulate, tax, and commercialize bhang. Let's be real, bhang is not all good vibes and freedom. Excessive use, especially among teens and youth, has been linked to mental health problems like psychosis and schizophrenia, addiction, impaired judgment, leading to crime and risky behavior. We are seeing more youth in psychiatric wards due to cannabis-induced psychosis. This is why the conversation around bhang in Kenya needs balance, not moral panic, but not blind celebration either. As of 2025, cannabis remains illegal in Kenya, but the tide is turning. Activists are lobbying, politicians are debating, investors are waiting, youth are experimenting. The question now is, should Kenya legalize, decriminalize, or keep the current laws? What would a well-regulated cannabis industry look like? And most importantly, who would benefit?